Dr. Greg Eckel, naturopathic physician and licensed acupuncturist. Background, I've been in Portland, Oregon here for 18 years. Got a family, a full family lives here, and love the community. Moved from Western Pennsylvania, small town in Western Pennsylvania, and moved out to the West Coast for the easy living. My background, I went to Dickinson College. It's a small liberal arts school in central Pennsylvania, cow country out there, and have a background in environmental science and policy and management studies. Rich science background. I didn't want to get into traditional medicine though. It was too, really never had any great interactions with physicians growing up. Great for acute medicine, but never really had a great doctor. Then I went to National College of Natural Medicine. It's the oldest naturopathic school in the country, and the best. I'm not biased on that, but we turn out the best clinicians, and went to 5 years of naturopathic medical school. At the same time, I did a 3-year concurrent Master's of Science in Oriental Medicine, and went year-round. I was the last year of the 5-year brigade. That degree, those 2 degrees now are a 6-year program. I think that it really did establish a good work ethic for me to, it's only gotten busier since I've graduated, seeing patients. And I did study in China at University of Sichuan in Chengdu province for Chinese medicine, although I have my degree from National College as well. We're primary care physicians in the state of Oregon, have a full formulary as far as prescriptive agents. 10 years now into practice. I find it very, I don't prescribe medications. In fact, I strive for a drug-free practice. I don't find the pharmaceutical approach to be very beneficial for my patients, and that doesn't leave them in a higher state of health at the end of my intervention with them. And so occasionally I will use prescriptive agents when they're necessary, so we do have a lot of options for people here. So a lot of times patients will ask me, or they come in with the assumption that it's all this medicine or their medical doctors. They always ask me, can I tell my medical doctor about you? And what I talk about is it's a patient-centered care of what we do. We don't hide anything. In fact, the more we can get your providers working for you, the better your health is. And so we play well is the way that I describe that to patients. I find a lot of my colleagues don't measure their results, and so there's no idea of where they're at. I develop comprehensive treatment programs. I also treat very complicated and recalcitrant conditions. And so, yes, I will help people with back pain, neck pain, shoulder pain, but I also, a good portion of our practice is those people that have been through the medical model and there's no answers and they're on a lot of medications and they still have symptoms. That is a great portion of our practice, from cancer care to Lyme to chronic viral illness to neurologic conditions. One of my focus areas is neurologic conditions, and you can see that on the website. I've got a list of kind of areas of expertise, and that is one of them, from Parkinson's to MS to unknown tremors, along those lines, and we tend to have some good success with those. It's because we have a lot of different approaches. We ask the question why, and using Chinese medicine, the pulse and tongue diagnosis, other modes of diagnostic testing, laboratory work. We look at the labs differently than medical doctors do as well. Putting that all together in a comprehensive program so that patients know, this is what it's going to take. This is what a treatment program looks like here, and here's how we measure our success with you. Basically, the whole philosophical bent, how it's different is, I say we ask the question why. I find a lot of medical doctors are not asking that question why. They have a lot of options as far as pharmaceutical interventions of, we can get rid of your symptom. The absence of symptoms is not health, though. I really orient people towards that, in that that's what's wrong with healthcare today, is we have a disease management symptom-based model of care. A couple prime examples. One, heart disease. The first symptom, 41% of the time, kills the individual. And so that's not great healthcare. That could be prevented. And we prevent that from happening a lot in our practice. Diabetes, another great care. You don't have a lot of symptoms at the beginning, So in traditional allopathic medical model, there's not much to treat. But once your sugars start to go off, that's where then drug intervention comes from. But it's a slippery slope from there on, is we're just managing a disease. If we can prevent that from happening and or reverse, which we see oftentimes with our method of treatment, we actually get people, we correct the imbalance by asking the question why, where is it coming from? We address people's diet, nutrition, their lifestyle stuff. It's not sexy, but it is very effective. And then I use acupuncture, Chinese herbs, Western botanicals, hydrotherapy. There are, the arsenal is large, so we have a lot of options. So we individualize treatment program for people. I could have 10 people here with the same chief complaint, let's say hypertension, I'm picking on that one, but come up with 12 different treatment programs for them. And so that's really where I feel we succeed in meeting patients' needs, is that's what gets me up in the morning, is how do I develop a program to meet this person where they're at and get them results.